Hello, and a very warm welcome to you. Please have a seat. Let us talk like old friends. If you are a man who has passed 50, 60, or even beyond, it is very likely you have found yourself thinking about something deeply personal. It is the kind of topic we usually do not discuss at a neighborhood barbecue or while standing in line at the bank. In my practice, I see many men who, once the door is closed, look at me with a hint of doubt and ask, "Doctor, is masturbation still normal at my age, or worse?" They wonder in silence if they are unknowingly harming themselves. If that thought has ever crossed your mind, I want you to take a deep breath and know right now that you are not alone. This is one of the most common concerns men have as they age. Unfortunately, the subject is still surrounded by old myths, decades-old taboos, and a massive lack of clear information. Think of it like having a classic car in your garage. You know you need to change the oil and check the tire pressure, but no one ever really explained how to care for the engine after 20 or 30 years of use. Many men live this stage of their sexual life as if they are trying to manage a vital part of their health while blindfolded. Today, we are going to open those eyes. We are going to have an honest conversation based on science and what I see in clinical practice. I am not just going to tell you what you want to hear, but what the studies actually show. We will explore benefits that will surprise you, but we will also talk about the risks you need to know to ensure your health always comes first. Stay with me until the end, because understanding this can change how you view your well-being for years to come. Many men tell me, "Doctor, I am past the stage of worrying about this. My body is not what it used to be," but that is exactly where the danger of mistaken thinking lies. Let us start with the first major benefit, the physical health of your penis. Have you ever considered that the penis functions much like a muscle that needs oxygen? When you have an erection, whether with a partner or alone, it is like taking your body to the gym. During arousal, blood flows into the internal tissues called the corpora cavernosa. Think of it like an irrigation system in a garden. If you never turn on the faucets, the hoses dry out and the earth hardens. By maintaining regular blood flow, you are keeping those tissues flexible and healthy. This is fundamental so that as years go by, you can continue to have firm erections. It is the old saying, use it or lose it, but explained through physiology. Keeping up the activity ensures the tissue does not become rigid or lose sensitivity. Now, I know what you might be thinking. "Doctor, what about my prostate? I have heard my whole life that too much sexual activity could wear it out." Well, get ready for what modern science, including studies from Harvard University, has discovered. This is a game changer. Benefit number 2 is specifically the protection of your prostate. Researchers noticed that men who ejaculate more frequently have a significantly lower chance of developing prostate cancer. Why does this happen? Think about the plumbing in your house. If the water stays still for too long, sediment and grime begin to build up. The prostate works in a similar way. Regular ejaculation helps flush out substances and fluids that accumulate in the prostatic ducts. It is a natural preventive maintenance service. You are cleaning the system and ensuring everything works without obstructions or unnecessary inflammation. It is a simple, powerful way to protect yourself while enjoying pleasure. You may have never heard of this, but let us move to benefit number 3, strengthening your pelvic floor. You might ask, "What is that, doctor?" Think of the pelvic floor as a support hammock that holds all your internal organs in place. You know when you cough or sneeze and fear a little urine might escape, or that annoying dripping after using the bathroom? That is usually a sign that this hammock is loose. During orgasm, involuntary and rhythmic muscle contractions occur. These contractions are actually an internal workout for your support system. Keeping these muscles strong not only helps avoid urinary incontinence, which bothers many men at our age, but also provides better support to maintain an erection for longer. It is your hidden support system becoming more robust every time it is exercised. Next, let us talk about something that affects us all: stress. You might think that since you are retired, you no longer have work stress, but the truth is that worries about health, family, and the future remain. Benefit number 4 is the natural reduction of cortisol. Cortisol is our main stress hormone. High levels of cortisol act on your body like sandpaper, wearing down your arteries, increasing your blood pressure, and stealing your sleep. When you reach a climax, your body receives the opposite signal. It is time to relax. There is a sharp drop in stress levels. It is like hitting the reset button on your nervous system. Using personal pleasure as a way to care for your heart and mind is not just enjoyable, it is preventive medicine. This leads directly to benefit number 5, the release of your own well-being cocktail. You have likely noticed that feeling of deep calm right after an orgasm. That does not happen by chance. Your brain is an incredible natural pharmacy. It releases dopamine, the neurotransmitter for motivation and pleasure, and oxytocin, known as the hormone of affection and connection. For a mature man, this boost in mood is incredibly valuable. It fights feelings of loneliness, improves self-esteem, and brings a sense of emotional connection with yourself that is vital for mental health. It is a natural antidepressant without side effects, available at any time. You might think, "Doctor, I know myself well. Do I really need this?" Well, benefit number 6 shows that masturbation is actually a diagnostic tool. Think of it as a technical inspection for your own vehicle. When you touch yourself regularly, you get to know every inch of your body. You notice if there is a small lump where it should not be, if the skin has changed color, or if there is a hardened area that was not there last month. Many cases of testicular cancer or penile fibrosis are discovered by patients themselves during these private moments. This is your chance to be the first to notice if something is wrong, allowing us to treat any issue early when the chances of a cure are nearly 100%. Talking about health, how is your sleep? Many of my patients complain that after 60, the nights feel shorter or sleep becomes very light. Benefit number 7 is the improvement of sleep quality. Remember the oxytocin and prolactin we mentioned? These hormones, combined with a drop in cortisol, create a natural sedative effect. It is as if your body receives a thermal signal that it is safe to shut down the machines. Instead of turning to sleep medications that often leave you groggy the next day, post-orgasm relaxation helps you enter that deep restorative sleep that truly recharges the brain. Now let us address a point many men avoid, but one that is very important: ejaculatory control. Benefit number 8 is exactly that: mastering your own reflex. Perhaps you find it difficult to last as long as you would like, which creates anxiety. Masturbation offers a safe, judgment-free environment. There is no pressure to please anyone but yourself. It is the perfect place to practice techniques like the stop-start method, learning to identify the exact moment your body reaches the point of no return. This self-knowledge translates into more confidence when you are with a partner because you become the master of your own signals. Benefit number 9 concerns one of the greatest tools we have, our brain. Many people forget that the brain is the most important sexual organ you possess. By using your imagination, fantasy, and regular physical contact, you keep the neural pathways of desire active. It is like keeping a forest path cleared. If you stop having sexual thoughts and practicing the activity, these circuits begin to atrophy. Keeping your libido active through regular practice ensures that even if you do not have a partner right now, your body and mind will be ready and responsive when the opportunity arises. Finally, benefit number 10, the maintenance of your identity and autonomy. Aging does not mean retiring from life. Maintaining a healthy relationship with your own body and pleasure is a way of telling yourself that you are still alive, that you are still important, and that your needs matter. It is an act of self-care that reinforces your vitality. Now, I need you to listen to me very carefully. As a doctor, my duty is to be thorough. We have talked about wonderful things, but health is about balance. You might be thinking, so there is nothing wrong? I can do this all the time? Well, it is not all roses if you do not have moderation and awareness. Just as physical exercise is good, but excess can injure a tendon, or a healthy diet is good, but too much of one thing can cause chemical imbalances, masturbation also has points of caution that every mature man needs to consider. I want you to understand that being proactive with your health goes far beyond what you do alone in your room. Nothing we discussed here, not the diet, the exercise, or the frequency of ejaculation, replaces my role or the role of your trusted urologist. Especially if you are over 45 or have a family history of cancer, the PSA blood test and the physical exam are indispensable. Masturbation helps clear the ducts, but it does not remove a tumor that might already be there. Do you see the difference? It is maintenance, not a miracle cure. Now you must be curious, doctor. What are the risks or negative effects I need to know? There are situations where what should be a benefit starts working against you. It could be a physical sensitivity issue due to excessive force, what we call a grip that is too tight, which ends up making intimacy with a real partner more difficult. Or it could be the psychological impact if it is used as a constant escape from emotional problems, creating a chemical dependency in the brain for that dopamine hit. There is also the matter of skin and tissue health. With age, our skin becomes thinner and more sensitive down there, and small traumas can open the door to infections that we would not have had in our 20s. I have prepared a detailed explanation of these 10 risks and the fundamental precautions you must take so that all the benefits we listed are not canceled out by a mistake or a lack of technical information. Ignoring these points can turn a healthy practice into something that brings pain, discomfort, or even anxiety. So, let us do this. If you really want to master your health and live this phase of life to the fullest, without fear and with total security, I invite you to the second part of our conversation. It is vital that you know where the danger signs are on the road so you can drive with peace of mind. Remember, a healthy sexual life, which absolutely includes conscious masturbation, is your ally, not your enemy. But complete information is what gives you the power of choice. I am waiting for you right now in the next video, where we will uncover the care and risks that every man of respect needs to know to keep his machine running perfectly. Shall we go together? Click now, and I will see you there.